Hey everyone, Dr. Charlie Johnson, physical therapist. Real quick, I want to talk about the truth surrounding medications and shots or injections for the treatment of back pain or really any ache or pain that you have. And the truth is that while these things are sometimes useful in the short term, they're really, for the majority of people, useless long term. So with that being said, when are medications or shots helpful if you have back pain? The one time when they might be useful is if you have what we call a chemical source of pain. There's two types of pain, okay? There's a chemical pain, and that's sort of that means that you have some inflammatory response going on. So maybe you just bent over, picked something up, and you have, really severe pain that's constant, okay? That might be a time where, you can barely move type of thing, where medications or injections might help sort of, put out the fire, so to speak, kind of calm things down, okay? And in that case, again, they may be useful. So in that acute situation where you're in a lot of pain, you're having trouble doing things, all right? But if you've had back pain for a while, injections and medication are often really useless. And here's when they're really useless. Not just useless, but a double whammy there. So double useless when, let's just say you go to the family physician and they refer you to an orthopedic physician and you've taken some medication, maybe some steroid pack or anti-inflammatory, or you've had an injection to your back, or maybe a muscle relaxant, which just makes people groggy, they can't drive, and they don't feel that great. Anyway, point being is maybe you've had those things, and you wake up the next morning feeling great, okay? Well, that's sort of like a false sense of hope, because really what it did is it kind of put a Band-Aid on the problem. It didn't actually fix the root cause. So it treated the source. Okay, it went in there and kind of calmed down the fire, put some water on the fire, chilled it out, made you feel better, but you continue to move, you continue to do things that aggravate your back, and you think you're in the clear, but you're really not. So it's sort of dangerous, okay, and that you're setting yourself up for re-injury without actually handling and getting to the root cause of your problem, which may be as simple as the way you're doing everyday things, okay? So, useful, short term, and I'll put a question mark there because, again, it can be dangerous if you get short-term relief and you feel great and you go about doing everything that you once did. You are bound to have the same problem again, okay? Ultimately, although they do help 3 or 2/3 of people when they're in this kind of hot or acute stage, they are long-term useless, okay? So, and again, just to reiterate, imagine this. So if you had a paper cut, okay? We've all had paper cuts before. And you have a cut on the back of your knuckle, right? And you want it to heal. What are you going to do? Well, you're going to put maybe some Neosporin. You're going to put a Band-Aid over it, kind of, rest it, try not to bend it too much, right? That kind of thing, right? And it should heal, right? That would be normal. Now, let me ask you this. If you continue to bend your knuckle every 15 minutes and open the wound again, well, you would expect that it would not heal, right? It would be crazy to think that if you continue to crack that scab open that you would heal anytime soon, right? Medications or injections are sort of the same thing. So if you get medications or injections, it's sort of like camouflaging or altering the symptoms. So you're putting a Band-Aid over it, maybe putting some Neosporin or whatever you use to kind of protect the cut, but you continue to sit at work poorly, or you continue to lift things over improperly, or you continue to do different things that are essentially bending the finger, or in this case, moving the back in a certain direction that continues to pick the scab. So again, medications, injections, if you're in really bad pain, they may be useful, but again, if you get relief from them and you don't change the root cause of the problem, you're treating the source, you're not getting to the root cause, you're going to continue to have pain, and you should expect that you will have recurrent back pain because you never actually got to the root cause of the issue. So if you need help, email me directly at charliejohnsondpt@gmail.com. Hopefully this helps you out and gives you a more informed sort of idea or thought process about whether or not you should be taking medications or having injections or shots for your lower back pain. Thanks.